racial discrimination was associated with contamination and harm OCD obsessions, and also washing and repeating compulsions. While this research didn't specifically say that Black people are more likely to experience contamination OCD, it does suggest that we really need to know how contamination OCD might be showing up in our communities. Now, this does not mean that all of our coping is OCD, and it doesn't mean that using a scalp scrub on your hair, making sure to wash your legs, or using a washcloth on your body is born out of mental illness. It's important that a therapist does not stigmatize any part of our culturally based self-care routine. It's important that in therapy, we honor every part of who we uniquely are. Hi, my name is Saraa Lee. I'm a licensed clinical social worker and also a clinical supervisor with NOCD. This video is part of a series on OCD in the Black American community, where I'm going to be highlighting some of our own unique perspectives and experiences. The goal is to help more of us learn about the symptoms of OCD, to get more of us into treatment, and to teach therapists about how to work with us so that we can get better and stay better. On July 13, 2023, Natalie S. Ohio published an article in Medium.com titled, "The Hygiene Olympics Has Black People in a Chokehold." The article was written by a Black woman, and it described how Black people work extremely hard to take good care of themselves. The author acknowledges that this is partly because of our rich history and unique needs. But the article highlights that some of the focus on physical self-care is born out of a painful desire to run away from or destroy persistent, untrue, and negative stereotypes created about us in this anti-Black racist culture. These lies help to provide inhumane justifications for enslavement and segregation, including that we smelled bad or that we were dirty. And as a means of resistance, many of us leaned even more heavily into ensuring that we were clean, that we smelled good, that we looked neat and were dressed to the nines whenever we left the house. Now, in a society where we had little control over the laws, the economy, and the way we were treated for a long time, turning to actually what we could control was a powerful way to try and change the world around us. And you know what? Resistance is important. It's brilliant for us to lean into this as a means of trying to solve a social problem. And also, living in a racist society has caused us to be at a greater risk of developing mental disorders. This coping strategy for some people can become an expression of OCD for others. In fact, in 2021, research conducted by Monica T. Williams and Joseph Robert Taylor et al. Focused on OCD symptoms among Black Caribbean Americans. That research revealed that racial discrimination was associated with contamination and harm OCD obsessions, and also washing and repeating compulsions. While this research didn't specifically say that Black people are more likely to experience contamination OCD, it does suggest that we really need to know how contamination OCD might be showing up in our communities. Now, this does not mean that all of our coping is OCD, and it doesn't mean that using a scalp scrub on your hair, making sure to wash your legs, or using a washcloth on your body is born out of mental illness. It's important that a therapist does not stigmatize any part of our culturally based self-care routines. It's important that in therapy, we honor every part of who we uniquely are. Now, if you use 6 different products on wash day, girl, same. If you layer a couple different lotions and fragrances so that you feel beautiful throughout the day, that sounds amazing. And I'm all for it. If your shoes match your belt and your hat, stun, period. If somebody is stigmatizing your practices, advocate for yourself and feel free to go if somebody comes for your wash and go routine. Now, with that being said, and with all respect to shea butter, I want you to know 3 ways to tell if you or someone you love has crossed out of the realm of Black joy and into the realm of OCD when it comes to personal care. Sign number 1 is spending a ton of time washing and rewashing. And this urge to wash repeatedly could be coming from several different sources, including feeling dirty, or maybe seeing something that you interpret as a flaw that you want to fix, or even intrusive thoughts or rigid beliefs that you need to do things exactly 3 times or 10 times in order for you to be clean. These behaviors would be considered OCD compulsions, and they could be causing chaos in your life, such as missing important events, distancing yourself from loved ones, or jeopardizing work because of the time these hygiene rituals take. This could also be causing damage to your body, including dry skin or hair breakage, which is the complete opposite of the goal of the self-care hygiene. This could be turning into a sort of self-harm. Sign number 2 is that you believe your washing rituals will determine the outcome of the day. If the goal of washing your hands, taking a bath, and washing your hair is to be clean, to smell good, and to look good, then that sounds reasonable. But if the goal of having a perfect routine is so that bad things don't happen today, then that suggests that you're trying to use these behaviors, which we would call compulsions, to try and control your fear and control the world and control the behavior of others. And while it's true that we might experience better treatment when we look nice, we still often experience poor treatment from racism, like being followed around in the store, no matter how good we look. The third and final sign we're going to discuss is if you are avoiding people, places, and things that you care about because you don't want to have to decontaminate and clean yourself and clean your home again and again. And I know we all won't be going over everybody's house like that. So you have a right to determine where you feel good, where you feel comfortable, and where you feel safe. It also makes a lot of sense to be mindful of who you invite into your living space. But part of life is gathering with friends and people you love. And if you are constantly refusing to go to other people's houses or maybe host an event because you're avoiding all the work you would have to do to wash and clean and rewash your space, this is a sign that your worries about being clean are going beyond self-love and stopping your ability to enjoy life. So now that we've gone over some signs to watch out for, I want to talk about what you can do about it. So the goal of therapy is not to stop you from taking excellent care of your skin and your hair and making sure you look good. It's not to convince you to walk around looking any kind of way. The fact is that we do need to be careful when we're navigating society and other people's anti-Blackness. Safety is our first priority, but OCD can make this an even harder burden to bear. So the goal would be to untangle OCD from your ways of self-care, self-protection, and resistance. Thank you so much for hanging out with me for this video. If you're ready to take that next step or you're curious about it, go to NOCD.com or download the NOCD app. All of our therapists are trained to handle all kinds of OCD. And be sure to speak to the care team or your provider about your specific areas of need. We have consultation groups, supervision, training, and ongoing education from some of the leading OCD specialists in the world. And this helps us to ensure that you are getting quality care.